and then hopefully we can turn the transcript.
Brilliant, thank you.
Okay, you're very welcome. So I'm from Community Dental Services, and we are commissioned by the Oxfordshire County Council with the aim of improving the oral health of Oxfordshire. So we work with everybody and anybody, any group, right from our littles, our early years, up to our care homes. You'll find us delivering training. So we go out and about and we talk to the community face to face. We train your health professionals, your GPs, your midwives, in the key messages all around oral health, and everything we talk about is evidence-based, and it comes from something called the Delivering Better Oral Health Toolkit, which you don't need to really know about, but it is almost the guidance for all health professionals, all dental health professionals in the UK. So I'm just going to share my screen, and what I do encourage is obviously chat to me throughout. If you have any points or things that will work well for you or subjects that you want to raise, please do. Likewise, if you'd like to hold on to any questions to the end, we will make sure that there is a section at the end where you can ask me questions. But do feel free to sort of contribute and have a chat with me throughout. We don't want this to be too formal. And I'm just going to share my screen. So if somebody can just shout at me that you can see it okay, that would be fantastic.
Yeah.
Perfect. Yeah. Thank you very much. Right. Turn those off. Lovely. So, oh, I've skipped about 10 slides somehow. Let's come back out of that. Start again. Right. Okay. So, why are we talking about oral health? Why is it so vital? So your oral health is key to your general health and well-being. So there's a couple of key reasons for that. So the first one is that the bloodstream from your mouth links directly down into your heart. And that is where you can get heart conditions, heart disease. The second reason being that bacteria left in the mouth can be aspirated or breathed back into the lungs. And that can give us our aspirational pneumonia or lung conditions. And if you look at the list of links between poor oral health and other health conditions and illnesses, it's absolutely huge. Okay, so this little diagram here is just some of the links, but we're even looking at links to things like dementia. Obviously, you might not have expected to see stroke, diabetes on there, but it really is huge. And so when we say that the mouth is the gateway to somebody's overall health and well-being, it really is. Okay, so it's really key that the mouth is a priority, and that we are looking after somebody's oral health in order to maintain their overall health and well-being. Now, what's the impact of obviously not looking after somebody's oral health is pain, discomfort, sleepless nights, swellings and infections, affecting somebody's ability to speak or to eat, somebody's confidence and their self-esteem. This impacts all of us. Okay, very often when I ask somebody, you know, what's the first thing you notice about somebody else, they will say their smile. Okay, so it really is a vital part of our appearance and how we feel about ourselves, and also how we view other people. Okay, so it does affect confidence and self-esteem. And please don't think that this is just adults. Okay, I've seen children massively impacted by their oral health, and likewise I've seen women in their 80s, 90s coming into the dentist and having their teeth whitened. Okay, matters to all of us. Time off school and time off work. So poor oral health is a leading cause for children having time off school. Okay, so an almost entirely preventable disease, yet we're seeing children miss a lot of time off school for it. And obviously, if children are missing time off school, then likely their parent or their caregiver is having to take time off for work as well. Treatment being needed under general anaesthetic. Now, treatment under general anaesthetic comes with its own risks. We don't want anybody to be going under general anaesthetic unless it is absolutely necessary. But each one of these extractions under general anaesthetic costs our NHS around £800 per extraction, and that is only set to increase. So it also has a huge impact on our NHS. And stress, so a negative association on dental visits. So if appointments are frequent with pain, discomfort, needing treatment or needing referrals, children are likely not going to want to go. Okay, and that goes right up into adulthood when we get this almost fear or this negative association with going to the dentist. So there's three key elements or three key aspects to good oral health, and that is your toothbrushing, your diet, and your dental visits. So what I'm going to do now is talk about the top tips in all of them, and then give you some more guidance under each category in terms of a SEND perspective or point of view. So initially, why do we even brush our teeth? So I ask people this all the time, and you might think that this is a trick question, and it absolutely isn't. Did everybody brush their teeth this morning? And just unmute. Yeah, I can see heads nodding. Yeah, absolutely. Why? Why did you get up this morning and brush your teeth?
Makes you feel fresher.
Yeah, absolutely. Yeah. Any other reasons? This isn't a trick question. Don't think I'm trying to catch you out here.
It's
Why
habit,
did you wake up
isn't
this
it?
morning?
It's habit. You just do it. Yeah.
Yeah, absolutely. Yeah. Anything else? Any other reasons?
Or if you're going to be speaking to people out in public.
Yeah, absolutely. So for sure, there's loads of reasons that we all got up this morning and we brushed our teeth. It's part of our habit, it's part of our routine. We're about to socialise, aren't we? So we're going off to work, or we're going to go and talk to people, and we want to be fresh and clean and nice smelling breath. Teeth don't feel nice in the morning. They feel rough and dirty and gross, and we like to brush them. But there's loads of reasons. And the reason I ask this question is because I want people to establish that there's lots of reasons that we do it, but also why it is so important to the individual, okay, who we're supporting as to why we're brushing their teeth. There is a key reason that we brush teeth, okay, and that is to remove dental plaque. So dental plaque is a soft, sticky film of bacteria. And if you have a look in the image there, it is the yellowy, sticky bacteria that's building up around the gum line. And it's constantly forming. So it really doesn't matter if you have got amazing oral health or poor oral health, that plaque is always building up. So we always need to be brushing our teeth. Now that plaque is full of thousands of teeny tiny bugs and bacteria. And those bugs and bacteria essentially sit on your teeth and wait for you to consume sugar. Anytime you eat sugar, those bugs and bacteria feed on that sugar, they fill up their bellies, and then ultimately, because they've eaten something, has to come out the other end. So they then poo on your teeth, and that poo is acid. Okay, and that is what causes holes. Really, really common that when we're at school, we are taught that bugs eat teeth. They're not eating teeth at all. They are pooing on teeth. And that book that's on the slide there, Open Wide, What's Inside by Alex Rushworth, is amazing. And it breaks down all about what happens in the mouth when you eat sugar, if you leave plaque on the teeth, and how the sugar bugs poo on your teeth. You can buy Open Wide What's Inside on Amazon, but if you prefer not to, head over to Community Dental Services on YouTube, and I've read it for you. So you simply just play it. So you can play it to children so that they can hear the story, but it's a brilliant, brilliant book. So for tooth decay to happen, you need tooth, you need plaque, and you need a frequency of sugar. So it's not just how much sugar you consume, but how often are we consuming it? So when it comes to toothbrushing, what's the guidance? So children under the age of 8 should be supervised. Most parents and caregivers have stopped supervising toothbrushing long before a child has turned 8. Okay. Now, 8 might seem quite old, but the reason we say 8 is because it's proven that children do not actually have the manual dexterity to brush their teeth until they're at least 8 years old. I did an experiment. So I took it was a 5-year-old, a 6-year-old, and a 7-year-old, I believe, and I got all 3 of them to brush independently. And then they did something called a disclosing tablet, and you may be familiar with what that is, but it's a little purple or pink tablet. You chew on it, you swill it around, spit out the excess, and it stains any remaining plaque on your teeth purple or pink, so you can see what you've missed. So I did that, took some photos, and then I got them all to brush with a parent or a caregiver, and we did the same experiment. And I'm not saying that that parent or caregiver managed to remove everything, because they didn't, but they removed a lot more plaque. Okay, so it's really beneficial. And disclosing tablets, if you've got a child who will do a disclosing tablet, it can be really visual, beneficial way to see what areas in the mouth are being missed. So even for us as adults, we do very commonly miss a certain area in our mouth repeatedly. We tend to brush with our dominant hand and then turn over and miss this section in between. And a disclosing tablet can be a really great way of seeing that. Where are we missing? What areas do we need to focus on? When do we need to be brushing? So last thing at night time before bed, and at least one other time during the day. Now you might read that and go, but it's morning and night, and we all know it's morning and night. Now, the reason we brush morning and night is because of everything we just discussed when I asked you why you will brush your teeth this morning. Your teeth don't feel very nice in the morning. You're going out to socialise or to school or to work, so you want to have nice teeth, okay? But statistically, we could brush our teeth at a different time of the day, okay? So that bedtime one is vital. And the reason for that is during the day, you are producing about a pint of saliva. And that saliva helps to wash away and neutralise that acid from the plaque. So saliva is your body's natural defence against tooth decay. However, at night time, we produce just about a teaspoon. So if you leave those bugs and bacteria in the mouth overnight, it's the optimal time for decay to happen. So if you have got somebody who is really reluctant in the morning, perhaps they don't sleep well, and the morning is just not a good time of the day to toothbrush, you could do it a little bit later on in the day. Okay, but that nighttime one, so last thing before bedtime, so ideally half an hour after their last meal, we do toothbrushing before bed. That is our goal and our main one that we want to focus on. Want to use a small-headed, soft bristled toothbrush. Toothbrushes for some reason seem to be getting bigger and bigger and bigger. Okay, every time I go into a shop, I think, how are you supposed to brush your teeth with that? I, as an adult, use a child's toothbrush. Okay, they are much smaller and softer heads, so don't be afraid to buy one that is really small. And certainly for your child, they don't all come in characters or funny colours. If they're not wanting that, you can get a plain basic child's toothbrush. When do we change it? So if you turn a brush away from you and you're looking at the back of the head and you see those bristles either side, we then want to swap it out for a new one. Okay, it's not going to be effective. If it's not splayed, which is quite uncommon, especially with a child's brush, then it'd be every 2 to 3 months. And can anybody think of another really vital time to change a toothbrush out? I don't think of anything.
After illness?
Yeah, absolutely, Jackie. Yeah, any illness, cough, cold, sickness, COVID, anything like that, your brushes harbour a lot of bacteria. So if you have a bathroom pot full of all your toothbrushes and one person's poorly and they pop that brush back in that pot, can very, very easily spread around all toothbrushes. Okay, and that's how we all become poorly. So anybody that's unwell, keep a brush separate, swap it out for a new one when you're feeling a bit better. Children don't need mouthwashes. Okay, in fact, none of us need a mouthwash unless it is prescribed by your dentist. And if it was prescribed by your dentist, then the chances are it's a maximum of 1 to 2 weeks use. Okay, mouthwashes contain a very minimal small amount of fluoride compared to your toothpaste. So your toothpaste is high fluoride, and then if you use a mouthwash immediately after, you're rinsing away high fluoride with a small amount of fluoride. So it's backwards. Okay, and I'm not saying mouthwashes don't have their place. If people choose to use one or want to use one, then I'd recommend that it's after lunch or at a completely different time of the day. I would not have it with your toothbrushing routine unless it's prescribed by your dentist. Techniques for toothbrushing is ensuring that the bristles, whether you are brushing for somebody else or they are brushing for themselves, always trying to ensure that the bristles of the toothbrushes are tilted at a 45-degree angle towards the gum line. That is where that plaque is building up. Making sure that we brush long enough for every surface of every tooth to be reached. Now, I know that we very commonly say 2 minutes. However, if somebody hasn't got a full set of teeth, it's probably not going to take 2 minutes. And there's also adaptations that I'm going to show you in just a moment on the next slide that can quarter the amount of time you need to spend in somebody's mouth. So it's long enough to brush every surface of every tooth. Nice, gentle, circular motion. Okay, we do not want to go scrubbing. Nice, gentle circles. With a manual toothbrush, if you use an electric toothbrush, then the oscillating head is doing the movement for you. Okay, so it can take away some of that technique. Simply hold it from tooth surface to tooth surface, and the oscillating head will do the circles. In terms of fluoride recommendations, it's a little bit tricky. Okay, so the guidance states that 0 to 7 years need at least 1,000 parts per million of fluoride, and that 7+ need 1,350 to 1,500 parts per million of fluoride. Now, It's very cleverly done. And the reason that they say at least is because it means that marketing, when you go into your supermarkets, they can do 0 to 2, 2 to 3, 3 to 4, etc. in their toothpaste. And as a family with children of different ages, we buy the age range toothpaste because we assume that we're doing the right thing. However, children are not limited to an amount of fluoride. There is no limit. So them using an adult or a family toothpaste will only give them better protection for doing so. These age range toothpastes are not necessary, not giving your child the best protection, and also expensive. Okay, so you're spending a lot of money. Now, a lot of people say to me, that's all well and good saying that, Sophie, but my 4-year-old will not use Colgate or Oral-B because they say it's way too minty, or children often refer to it as spicy, certainly for a child that has got sensory difficulties to the taste of toothpaste. So what I recommend is if you go into Sainsbury's, Morrison's, Tesco's, anything like that, they all do their very own basic brand of toothpaste. It's not pretty. It doesn't come with a box, so it's better for the environment. And it's between 30 and 50p for a tube of toothpaste. That tube of toothpaste is suitable for all family members. And because they have massively reduced the cost, they have massively reduced the flavour, meaning it is a very, very mild toothpaste. So for anybody that struggles with the taste of the toothpaste, then that is a great option to try. What isn't suitable for children would be anything sensitive, okay, just because it's formulated slightly different, and anything whitening. Children's teeth are very, very soft. Whitening toothpaste are abrasive. They do not whiten teeth, they scrub away surface staining, okay, which can also, in turn, remove healthy enamel, which can make teeth quite sensitive. So we keep those away from children as well. Key message is after toothbrushing to encourage children to spit out any excess toothpaste and not rinse. So no water, okay? And that is because we know that it takes that fluoride about 30 minutes to soak into the teeth and actually offer them protection. So spit out, no rinsing, walk away. Really hard if you've got people that already do spit out to try to rinse out, sorry, to change that technique. But it is absolutely going to offer them the best protection. Kathy, you've got a raised hand.
Yeah, so my daughter, who's 27, won't spit out. Is that a problem?
So consuming too much fluoride, and we're talking a lot of fluoride, can lead to something called fluorosis. So I personally have fluorosis, and that's because I remember sitting as a child and eating my strawberry toothpaste out the tube. So you're eating a lot, okay? And essentially what fluorosis is bright white spots on your adult teeth. It is not harmful, but it can impact our appearance. Okay. All I would recommend for your daughter is that she has just a smear of toothpaste. If she's not spitting out, a small smear on her toothbrush is plenty. Okay. Children that are effectively, or people that are effectively spitting out, a small pea-sized amount is all you need. If you have a look at Colgate's TV advert, they grab your brush and they go, oh, this great big whack of toothpaste on the brush. And that is because as buyers, the more you use, the more you're going to buy. Okay. You do not need more than a small pea-sized amount. So anybody effectively spitting out, a little pea. Anybody not spitting out yet, a smear. Okay, swallowing toothpaste from a smear is not going to do harm. It's eating it out the tube that would. Okay, and that's why flavoured toothpaste are a little bit of a difficult one, because for some people having the flavour encourages them to brush, which is fantastic, and for some people having that flavour encourages them to sit and eat toothpaste, which isn't ideal. So it's finding that happy balance in between. So what about our top tips for making toothbrushing positive? Toothbrushing can be a real battle, okay, and we really do sympathize here. Every single person has their own difficulties. They find different things hard when it comes to toothbrushing, different things work, and it really is a matter of trial and error. Okay, and I know that can sound really disheartening because a lot of people want me to sit here and say this is the answer and this is what you do, and it's not that simple. It is a matter of trying different techniques and seeing what works well. So some of the things to consider here, and if you've tried these, you've exhausted this list, come back to us. we can look at it together. What can we look at differently? So when and where initially, where is that person most comfortable? Dragging them into the bathroom, does that set off you know, an initial upset immediately because they're not comfortable in the bathroom? Can we take toothbrushing elsewhere? Do they relax out on the sofa? Can we bring a brush and a little bowl to spit into to the sofa? You know, we can adapt where we toothbrush. We don't need water, okay? We don't need to wet a toothbrush because the saliva in the mouth will soften the bristles, and then we're not rinsing the mouth out. So the only time you need to use that water is to go back to the bathroom or the sink and rinse off the brush after toothbrushing. So toothbrushing does not have to be done in a bathroom. A lot of people tell me that they actually find bath time to be very successful because that person associates bath time with relaxing and fun as well. Some people find that being in front of a mirror can be really beneficial. I want you to imagine that somebody has got a brush and they're coming at you front on with a toothbrush. It's very intimidating, and instantly we want to sort of pull away and say no. Sometimes coming behind somebody and having them look in a mirror so they can see exactly what is happening and brushing from behind can really, really help. So it's just looking at the environment. Where's best? How does this work best? Is it that first thing in the morning, as I said, that person is really not cooperative? First thing in the morning is just not ideal. Maybe they have a really strong gag reflex first thing in the morning. A lot of people wake up in the morning and their gag reflex is really, really strong, and the last thing they want to do is shove a toothbrush in their mouth. Maybe just waiting mid-morning would make all the difference. I know that nighttime one, we don't have much choice on that one. As long as we've waited half an hour after dinner time, it could be then at any point from that half an hour before bed. Okay, so there could be some point. It might be that if you leave it till right before bed, they're too tired. Okay, and actually they're overstimulated, they're tired, they're ready for bed, and they don't necessarily want to have their teeth brushed at that point. We could make it a little bit earlier. Mirroring can be really beneficial, so brushing together, so you brush your teeth, they brush theirs, or a sibling or somebody else in the household that would be brushing at the same time. Sometimes it just helps us to realise that it's not as scary or as daunting as we believe it to be. Healthy habits and routines. We all live by healthy habits and routines. If you woke up this morning and you went to brush your teeth and you realised that you've got no toothpaste and you couldn't, it would probably stumble you into this little routine that where everything goes wrong. You know, we've all had it, haven't we, where one thing doesn't work and then it just sets us off completely and we're all out of routine and we're a bit confused and we're a bit overstimulated. Having healthy habits and healthy routines is really, really beneficial, and we really encourage everybody to make sure that toothbrushing becomes part of that. We all live by cues. So it might be that when I wake up in the morning, I go into the bathroom and I go for a wee, and then I know that I jump in the shower. So every morning my cue to have a shower is that I've gone to the toilet, and that works with toothbrushing as well. So we all live via a cue. We don't realise we're doing it. We're not mentally thinking that we're living via a cue, but we do. Okay, that's just how we work as humans. So having cues can be really beneficial, and I appreciate that initially we're going to have to start off by building these habits and these routines if we're not already in them, but ultimately it will benefit us in the future. Things like timers are visual, so somebody can see how much time they need to spend toothbrushing or how much time is left. Brushing charts, so positive reinforcement, having a brushing chart that we tick off or that we sticker, and step-by-step cards, so knowing exactly what we're going to do, when we're going to do it, and why we're doing it can be really beneficial. We know that knowledge helps us have motivation. So if we know why we're brushing our teeth, what's the step for, that can be really beneficial as well. Look at adaptation. So there's not a huge amount out there, but there are things we can try. So there's something called Collis Curve and Dr. Barman's, and on the next slide I'm going to show you a photo. But essentially it's a three-sided toothbrush, and it brushes the tops of the teeth and the sides of the teeth all in one go, which can quarter how much time you spend toothbrushing. So it might just mean that we can reduce that 2 minutes, and that will be much better for somebody that is reluctant or finds it difficult. Bite blocks. Okay, a lot of us struggle to keep our mouth open. I don't know if you've ever been to the dentist and they've looked in your mouth and your jaw is aching and it's really hard to keep your mouth open. Something like a bite block that can just go between the teeth to make somebody a little bit more comfortable. Finger brushes or silicone bristle brushes. The sensation of the bristles on the gum of a standard toothbrush can be overwhelming. So silicone brushes sometimes work. You will not get more effective than a typical bristled toothbrush. Okay, that is going to be your most effective toothbrush, but sometimes we do have to adapt. Some people can't stand the feel of the electric brush, okay, and some people find it really soothing. So that's something to trial and error. From the age of 3, children can use an electric toothbrush, and we really like one called a Brush Baby. It's got a really small head. Always please make sure that you buy a chargeable toothbrush and not a battery powered. If you put batteries in the brush, over time those batteries run out and the toothbrush becomes less effective, meaning that it's not performing as well. With a chargeable one, every night pop it back on the charger, keep it fully charged. It might be that having somebody pick out their own brush, a certain colour, character, one that makes a sound, might encourage them to brush more as well. Toothpaste wise, so what the ingredient in your toothpaste that makes your toothpaste foam is called SLS. And we can find that in washing up liquid or your washing detergents, and it makes it bubble. Okay, now a lot of people don't like the sensation of the foam of the toothpaste, so you can get SLS free toothpaste, and there's one that I highly recommend called Aura Nurse. Aura Nurse is both SLS free, but it's also flavourless. It's a really fantastic toothpaste. Please do also bear in mind that if you are somebody that suffers with sore mouth, so things like thrush or perhaps ulcerations, things like that, SLS can really burn. If you've ever brushed your teeth and had this overwhelming burning sensation, that is the SLS in the toothpaste. So having the SLS free can also be really helpful. So anybody that has ulcers or sores in their mouth, an SLS free toothpaste, and that Aura Nurse one is fantastic. Look at distractions. Having the TV on, the radio, chatting about your favourite subject or topic, completely removing us from the current situation. Different songs, different poems. And also looking at putting those distractions in every time you do toothbrushing can also help with that, establishing that habit and that routine. Positive reinforcement, we always recommend that you stay away from food when it comes to positive reinforcement. It's very, very easy to go down the route of giving food, but we try and stay away from that and look at doing stickers, books, weekly treats, etc. for toothbrushing. And as I said, trial and error, keep going, focus on the positives, and always praise for what's done well. It will be battle and it will be hard. And different things off this will work and different things won't. And I completely appreciate that it is a topic that is really, really, really challenging. Always remember why we're having the battle and why it is so important, somebody's overall health and well-being, and come back to us. If you are still struggling and you're still finding this difficult, let's look at it together. Okay, we can set up a Teams chat just like this and we can give you advice and we can help. Okay, and also other health professionals, of course. Let's have a quick look. Sorry, I keep losing my cursor on my screen. Let's have a quick look. Oh, here's some photos. So this is the Dr. Barman's and Collis Curve brushes in the top photo there. Dr. Barman and Collis Curve are brands and they're quite pricey. Have a look on Amazon and just type in 3-sided toothbrush and you'll find a knockoff brand for a lot cheaper because they are quite expensive. Just some example of a brushing chart, some timers, a bite block there, silicone bristle brush, and an unflavoured. So this is your Aura Nurse toothpaste. And Aura Nurse you can buy online. So if you have a look online, you'll be able to get Aura Nurse. So let's touch on diet, shall we? So what happens? So the mouth sits at a pH happily and healthily of around 7. And any time we consume something that contains sugar or acid, we have what we call a sugar acid attack. And essentially the pH level of your mouth has a drastic drop. And once it hits below 5.5, we enter a danger zone. Okay, so this is where we are most susceptible to tooth decay, when we've dropped below 5.5. Every time we have one of these attacks, every time we have one of these attacks, takes the mouth between 30 minutes and an hour to creep back up to pH 7 again. we're all going to have sugar acid attacks, okay? We all have sugar in our diet and we all have acid in our diet. The aim is to reduce the frequency. So if we have a look at this graph compared to, oh, if it will let me change this one. So this person, they've had their breakfast, lunch, dinner, but between them, they have had sugary or acidic snacks and drinks. Okay, and you see how much more of their day they spend down in that danger zone. So the goal is to have no more than 4 a day, which was the previous graph. And the way to do that would be to have anything sugary or acidic with your main meals. Okay, so either as part of your main meal or immediately after as a pudding. Anything between to be sugar-free and acid-free. Our big offenders here are drinks. So if you imagine, it's not very often that we drink something in one go. We tend to sip it over an extended period of time, which can keep us prolonged in our red zone, and also drip feeding. So if we are trying to keep somebody happy and content for a long time and we drip feed them a chocolate button every 20 minutes, again, we're going to keep them down in this red zone. So might not be as great for our waistline, but it's better for our teeth that if we have a bag of chocolate buttons, we eat the lot in one go and then we recover, then we eat one every half an hour and stay down in our red zone. Okay, so it's about frequency. So what are some of the things we want to avoid between our meals? Your typical things you'd expect to see here are your chocolate and your sweets and your cake. You might not have expected to see fruit, so raisins. Fruit changed in any way is no longer tooth friendly. Okay, so if I pick an apple off the tree, my apple is full of fibre and the fibre interlocks, and interlocking it holds in all the sugar. I eat my apple, goes into my belly, and as I digest it, I break apart the fibre, release that sugar, and I get a nice little boost of energy. However, if I take my apple off the tree and I cook it, I dry it, I blend it, I change it in any way, I have released the sugar in the process. So I break the fibre and release that sugar, meaning now when I eat it, it's sugary on my teeth. So be aware of your smoothies, your juices, your raisins, many cereal bars that have dried fruit, no longer a tooth-friendly snack. So I'm not saying don't have them, just try and keep them as part of a main meal or immediately after as pudding. Be very aware of children's snacks. 97% of children's snacks feature a nutritional claim. So they'll say something like 1 of your 5 a day, despite being high in sugar for the targeted age group. So children's snacks down a child's aisle, very sugary. It's very rare that you'll find something that is low or medium sugar. Drink wise, squash, whether it is strong or weak, no added sugar diet, drinks, smoothies, juices, anything that isn't water or milk, unfortunately. Anything else is still acidic, even if it's not sugary. Okay, so please be aware of drinks. Try and just have water and milk between meals and keep anything else to meal times only. So good foods and drinks would be your fruit in its whole form, vegetables, cheese, crackers, biscuits, breadsticks, rice cakes, natural yogurt, and of course your milk and your water. Unfortunately for us, we can have tea and coffee as well. Although it can stain your teeth, we can have tea and coffee. How do we find these things? So the Change for Life have a food scanner app. Okay, it's free to download, and it's very simple, but it's also really fun and interactive. So it's fantastic for children. And what you do is you scan the QR code on the back of a product, and it will give you a visual as to how much sugar that product contains. Doesn't just look at sugar, but it gives you visuals. This can be really beneficial if you're out with children and say, for example, you're walking around the co-op and they say, I want a snack. You can give them the app and advise them to try and find the one with the lowest sugar, or do it together. Weigh out sugar in foods, look at the contents, because having that visual of something really helps. A bottle of orange juice from Sainsbury's contains 18¼ cubes of sugar. 18¼ It looks healthy, it features a nutritional health claim, and I always say to people when I train them, if you went to pick up that orange juice and next to the bottle was the same bottle with 18¼ cubes of sugar in it, would you still pick it up? And they say, God no, I wouldn't dream of it. Having that app gives you that visual before you choose to buy or consume something, so it's really helpful. What's the sugar recommendations? So Public Health England state that under the age of 4, children need no added sugar in their diet whatsoever. That's really, really unrealistic. It's really unrealistic to say that 2 and 3-year-olds have no sugar in their diet. So the reason that they're starred there is because they are from a nutritionalist that worked with us at CDS. So the recommendation for sugar for the 13 grams and the 16 grams, and then 4 to 6, 7 to 10 and 11 plus are from Public Health England, and it's 19 grams, 24 and 30 grams for 11 plus up to adults. Much easier to remember in cubes because it goes 3, 4, 5, 6, 7. Okay, so just bear in mind 30 grams for an adult. Now, I don't know how much time we have, so yeah, I think I'm just going to show you these as opposed to make you guess them. But we're just looking at sugar content in some common children's snacks. It's just quite eye-opening. How much sugar is in some of these snacks. And again, all things really here that look healthy, don't they? Look like a healthy snack, something that as a parent or a carer, I'd walk down the aisle and pick up, assuming that I was buying a great snack for my child. You'd be much better off buying a block of cheese, a packet of crackers and a cucumber, chopping it all up and giving that for snacks throughout the week. Okay. Some top tips. So I know that, again, eating can be challenging, having safe foods and things that children will and won't eat, textures, etc. So some of our tips is looking at daily or weekly food menus and time. So can we encourage those children to join in on selecting recipes, cooking the recipes, picking out the different foods they want to eat that week? Visual tools, so things like fullness scales, happy and unhappy faces. You could even do happy and unhappy teeth faces so that they look at what's tooth friendly and what isn't. Food group chart, I thought this one was really good. So encouraging children to eat something from each category per day. So obviously we all know we've got the Eat Well guide, but looking at the different categories, fruit and veg, protein, etc. And can we encourage them to eat something from each food group per day? Have a look at sensory food education, and there's abundance of resources online, but looking at touching, smelling, seeing foods in a fun way and in an educational way. And early year settings should also be encouraging sensory food education. Some children will have never seen certain fruit or certain vegetables before, so doing things like washing fruit and veg, cooking together, painting with vegetables, etc. can be really beneficial to getting somebody familiar. Gradual desensitization, so little and often with new foods, not overwhelming children, but offering them to try something new, little and often. Mirroring the behaviour. Might not want to hear this one, but it's really good that we mirror the behaviour we would like to see in our children or the children we look after. Eating a balanced diet, snacking on tooth-friendly and healthy foods, and drinking water and milk throughout the day. Avoid labelling food as good or bad. Okay, so we know that it can be really easy to get a negative association with food. Every food in some way has a nutritional benefit to us, doesn't it? So we don't want to be saying any food is bad. Tooth friendly, we enjoy that, and certainly saying something that is healthy or certain, its benefits for us. And just like with your toothbrushing, looking at your environment. Is it better that we're in a social environment? Do we prefer to be in a quieter area, with our peers, without our peers, with distraction? So do we eat or get on better at eating with the radio playing? Do we prefer not to have that distraction? Again, trialing and erroring these things to find what works for each person. Healthy Start. I always share Healthy Start in case people aren't familiar, but it is a scheme designed to help pregnant women and children under 4 from low-income families to eat healthier. Essentially what it is a little credit card that you get given, and it is topped up with money on a weekly basis. And you can go into most supermarkets and use that card to buy fruit and veg, plain cow's milk, formula, and you can use the card to claim some vitamins and vitamin drops. We have seen a big increase in the people in Oxfordshire signed up to Healthy Start, but there's still a large percentage of people that are eligible that are not signed up. So please do either have a look to see if you're eligible or share it with people that you think might be. On our YouTube channel, there's a guide to Healthy Start, tells you what you can get and how to use it, but it's all online application now. It used to be paper application, and it also used to be paper vouchers, and people didn't like that. So now that it is just a card that is topped up, it has got more successful. So please do have a look at Healthy Start. Some resources here on our YouTube channel, different videos, different things you can look at. Not only is there videos for adults to look at, there's also videos for children to watch as well. So dental visits. So this is the tricky one, isn't it, at the moment? We're in a really difficult situation with access to dentistry. Please bear in mind that even if you are not registered, you still have a duty of care to be seen in an emergency. And what classes as an emergency would be loose teeth that are an aspirational risk, lumps, bumps, patches, swellings, and any trauma. So a knock or a bang to the face, absolutely, even if it looks fine from the outside, doesn't mean there isn't damage done underneath the teeth. Okay, so that would class as an emergency. The recommendation is the first dental appointment either with your first tooth or before your first birthday. And then as often as your dentist recommends. And for some of us, that's every 3 months. And for some of us, that's every 2 years. Okay, so it really is down to the dentist. Finding a dentist. The guidance is that you call 111 or you look on the NHS website. Now, I've had a lot of people tell me recently that the NHS website really isn't up to date. You search with your postcode and it will list you closest to furthest away with practices, and then under each one will say if they're accepting patients or not. It really isn't up to date, but it is a matter of calling, unfortunately, and asking for getting on waiting lists. From the age of 3, children are entitled to fluoride varnish, which is like a sticky paste that the dentist paints on the teeth, proven to really prevent tooth decay. Pretty much every dentist has it in their drawer, but not every dentist is so great at telling you they've got it. So please do ask for it. And then your referral system. So referrals for special care dentistry goes through Thames Valley OCDS, and you'll all get the PowerPoint with the link to them, which gives you a bit more information on referrals. But you can self-refer. You can ask your GP to refer you into special care dentistry, or it would be from your dental practice. So your current dentist can refer you in. Please raise that. The earlier you get your referral in, the quicker you are to get on the system. And have a look, go onto their website, have a look at criteria and see if you would meet that. Excuse me. So top tips. Oh, I haven't changed that look. I've put healthy eating and it's supposed to say dentist. Do apologise. Talk to your receptionist before you go. Okay, it's really important that the practice is aware that you are attending, that you might have anxiety, there might be special requirements or different needs. It might be that there's more experienced dentists, or it might be that there's a quieter waiting area, or they might be able to just extend your appointment by 10 minutes so that it's not as rushed. Do make sure that before you go, you talk to people. I spoke to somebody yesterday and she said that her son was OCD, and that if the dentist told him something, he would take it very literally. So she rang and said, this is the situation. Before we come in, please make sure that the dentist is aware so that they don't say anything that my son is then going to run with, and cause more damage than good. Some dental practices offer a quiet hour. So it's worth asking about that as well. So for anybody that might find the sensory of going into a dentist challenging, there might be a quiet hour. Weighted blankets, having headphones and sunglasses can also be really beneficial. It's bright lights, it's unusual smells, it's very, very overwhelming from a sensory perspective. And it might be that you can look at things that comfort your child to take with you. So it might be certain toys, certain tellies, even watching an iPad, something that might help. So please do look at taking that as well. And always prepare as well. Prepare to go. Role play at home. Practice opening your mouth. Watch certain TV programs. Things like Peppa Pig Goes to Dentist is a good one. And on our YouTube channel, we have got tours of dental practices as well. So having that visual before you go, what does it look like? What do you expect to see? What's the environment? can also be a good one. So again, I'll share the link to the YouTube channel as well. On our website, we've got something called a family fun and information hub, and it is just an abundance of resources. So there's leaflets, there's posters, there's sheets, there's app recommendations, games, lots of different things that basically make education around oral health fun and interactive. Please do have a look. Some of it you can do online, some of it you can download and print off, but we always want to be talking about oral health and keeping it a priority for all of us. So have a look at our information hub. If you go on there for information about something and it's not there, please get in touch, okay, because we can create resources and pull them together as well. Okay, what I'm going to do is stop sharing my screen. How are we for time? I just want to quickly, just before we go further, is Catherine from Healthwatch online?
Yeah.
Hello. So sorry to call on you. So we had a meeting yesterday. Healthwatch have been looking at resources and the oral health across Oxfordshire, and we realised after discussion yesterday that there's not enough resources for families or parents or caregivers of children with special educational needs, and we would like to pull some of this together, and we'd like to put it out to you guys and ask you what you think is needed. What subjects do you think are more information is needed about? Would you appreciate a pack of information with activities and brushing charts for children? Would you think a leaflet is ideal? So we just sort of, Catherine just came along because I said this might be a great group to actually talk to and find out this information, and we want to put the resource together that people actually want, as opposed to just run with it and make something that might not be needed or wanted. Gail?
Yeah, I'm just thinking, because there's a lot of us here that have got adult children who are now obviously not children but very much adults, but have learning disabilities, and some of the similar issues that you might have with children are there, but there are often other issues. So for instance, from my own experience, my son's nearly 34, but from he would refuse to open his mouth when he was little. I used to have to sit on him. I shouldn't be saying that, probably safeguarding alert, but when he was little, I used to literally sit on him because it used to make him laugh, because mum was astride him. Anyone watching from outside would have been a bit shocked, but it got me to give his teeth a really good clean. But all that timing stuff, so I've learned quite a lot today, because I think some of the things around the timing that would work really well for him. Anything that, or the smaller amount of toothpaste, anything, all those kind of tips. So I guess for us, I mean, we have an online all about health resource. I don't know whether you've seen it, and on there we've got our easy read stuff. There is things on there, I think, around learning disabilities. I think for me it's those top tips around when you're with somebody who refuses to open their mouth, won't stay to, that kind of, but doesn't have the level of ability to understand what you're trying to. So all of those tips for younger children, great, thank you. For my grandchildren, brilliant. But for Guy, all of those techniques, some of those techniques just wouldn't work. So it's about finding the ones that do. The biggest issue, sorry, I'm going on a bit. The biggest issue is for us is that he's not in my care anymore, that somebody else is doing it. How do I encourage the support staff to do all of these things? And how do I know? Because going to the dentist, if she does go regularly, getting him to open his mouth and so the dentist can have a really good look around. Actually, once a year we try and get him sedated to do that, but I didn't know you could ask for that until we got to severe. So there's all that kind of stuff. I think for us it would be something specifically around learning disabilities that would be really helpful. So and more or along autism, because there will be some families here whose children or young people have autism as well, so it's probably the sensory stuff.
So more along the lines of practical tips, as opposed to the key messages. It's knowing practically what you can do in brushing, diet, and dental visits. And
access to, where are how do you, I think the access to bit.
Yes, we've certainly discussed that.
If you've got a child, a young person who is who, you know, or you can't get, you know, who need that specialist support. You want to know the dentist is used to working with people like them, I guess.
Yeah.
I don't want to speak for everyone else, and there's other people got their hand up. So, Ruth, I think you were next.
Actually, Gail, you've said a lot of what I was going to say. I have exactly the same issues with Jake. His teachers attended today, which is brilliant. So hopefully she can also take away some of this and also pass it on to the service, because he's now in supported living. But I was going to actually ask, what do you do when they don't want to open their mouth? And we again, deprivation of liberty issue here, but me and Dad used to manage it by Dad gently restraining his arms, not heavily, but just holding his arms down so that he couldn't grab the toothbrush, while I went behind and did it. You know, it was really difficult, and there's no way we ever did it for more than 30 seconds, let alone 2 minutes. And yeah, that's what we would really like some tips with, I think.
Yeah. So again, it does sound very practical, isn't it? The practical, because like what we've looked at, because obviously I have looked at what current resources there are, and the majority do seem to outline the key messages, as in you need to brush twice a day and you need to use fluoride toothpaste and things like that, but they're not breaking down practically in your home or within your setting what you can actually do differently to help your child. And that is what I think we need to focus on, is those practical tips. And it is really difficult because they're obviously different for every person, and something will work for one and not another. And so it is just pulling key ideas together and having a list that
we'd be kind of happy to work with you on that as well, Sophie, because we could gather some of those top tips from other parents, which is what we do in a lot of our resources. We'll say, you know, give us your top tips. What have you done that's worked? And then that gives people an idea of what some of those things can be done.
Yes, absolutely. Thank you.
Jessica, you were next. Thanks, Ruth. Jessica, hi.
Thanks, Gail. I just wanted to say, I thought your you know, all your stuff about the you know, what snacks have sugar in and things like that, that was really useful, because I thought that sugar-free squash was okay. I didn't realise about the acid in that. And I think for maybe for some of the staff in supported living, you know, that just kind of that knowledge that we all really ought to have, but we've probably not all got a lot of it. I certainly didn't have. So I think that was really useful. And the second thing is, my daughter has severe learning disability and autism, and one thing for her is teeth grinding. You know, I don't think we're ever going to be able to stop that for her, but sort of tips around that and the sensory aspects that are related to that, I think, is probably really useful.
Absolutely. Yeah, absolutely. Thank you.
Thanks, Jessica. Julie.
Hi, I have a little one. He's 4, severe reflux, peg fed, learning disabilities, sensory issues, and the Aura Nurse has been amazing. We've been using that for about 2 years now. Absolutely amazing. Brilliant. Expensive, but amazing. The one thing that really helped us is the dentist down at Mansell Way, who we see, is absolutely amazing. She will sit on the floor, roar like a lion, and be an absolute idiot to make him laugh so that she can see in his mouth. And she referred us on to a fantastic lady, specialist dental nurse in Kidlington, who absolutely took us through the different toothbrushes. She gave him a little mirror on a stick that he can play with. She took the stress off me. This whole 2-minute issue that I've been stressing over for years, she just took it away completely and said, you know, anything you can do, anything is a help.
Absolutely.
And obviously he doesn't like Peppa Pig, so we have the Mr. Tumble cleaning his teeth, using the mirrors, all these little things. My only regret is we didn't get to see her 2 years ago. I could have done with everything that she's offering. That information has been so crucial. I could have done with that 2 years ago. But having said that, I'm grateful we now have it, and I've been sharing with all my friends.
Fantastic. And that's amazing, isn't it? Because sometimes it just takes that to, you know, to be able to say, you know, try this dentist or this person would make all the difference. And that's absolutely brilliant news. Fantastic.
Thanks, Julie. We've got Jane next.
Hi, just two questions from what you've been saying. Is there a significance of the half hour after food to be brushing? And
Yes.
the other one is my adult, well, grown up adult, over 18 daughter. The dentist has said she should be flossing.
Okay.
Which you haven't mentioned.
Yes. So
which is a nightmare, of course.
Yeah, of course. So the half an hour after is purely because it takes around 30 minutes for the fluoride from the toothpaste to soak into the teeth. So we then don't want to be eating whilst we're allowing that fluoride to soak in and work.
I thought it was a half hour after eating that you don't brush your teeth.
After eating, sorry. Yeah. So it works both ways. Okay, so it's half an hour before or after food. So before is to allow the fluoride to soak in. After is just because you've weakened the enamel, because the chances are if you've had sugar or acid, you've put the mouth under attack. So into that state, that under 5.5, you've weakened the enamel. So to go in and brush your teeth with the weaker enamel, it can cause more damage. So you allow the mouth to recover, come back up to your pH of 7 before then going in with a toothbrush. Sorry to sound confusing. Yeah, half an hour before or after food is the general rule of thumb. People always say to me, oh, before or after breakfast. Doesn't really matter one way or another. In terms of incidental cleaning, so this really depends on who really, because for me, as I think if toothbrushing is a huge challenge, that needs to be the focus. Incidental cleaning is really, really important. And if you are working with somebody or looking after somebody, sorry, that is capable of incidental cleaning, amazing. And you have got a couple of options. So you've either got floss or you have got something called an incidental brush. And the floss it requires a bit more technique. It's more fiddly, it's trickier to do. And also if you are rough or you do it wrong, you can cause damage and pain. The brushes take away some of that technique for you. They're a bit easier to use and they are my personal preferred method to recommend. The only difficulty when it comes to the brushes is that they come in different sizes. So it might be that you have got one gap that fits a red brush and 3 gaps that fit a blue one, and if you know what I mean. So the aim is that those brushes are snug but not tight. So you do not want them to cause any pain. And they're simply in and out of each gap and rinse under the tap after each one. And they're a bit more straightforward. They're reusable up to about a week. And that could be something that you give a go. But if brushing is a challenge, then please allow it to be your focus. And then you can look at your incidental cleaning. Another point to mention, just because you've raised it, is bleeding gums. Bleeding gums are a sign that gums need more attention. Okay, so if you are noticing bleeding gums, keep going. Don't avoid certain areas. Okay, that is your gums asking for more attention. Thank you.
Okay, thank you.
I think Jackie's had.
Jackie, yes.
Hi, this was I've got a daughter who wants to go to the dentist all the time, and we're not sure if she's crying wolf, you know, saying, oh, I've got tooth pain. But you mentioned sugar acid attacks that can happen. Could they make that person feel like they have got sore teeth, even if there isn't an issue there? Because along with a lot of other people with learning disabilities, she finds it very difficult to tell me what is actually wrong. Which was, got a sore tooth, it's here. And so I'm taking her to the community dentist and they say, no, she's got perfect teeth, there's nothing wrong. So could that be something that would be causing?
Are you finding it in line with when she's had sugary foods? Yeah. Okay. Yeah, it's very common. And that is purely because you've got deep fissures. They're called fissures in your teeth, which is the grooves basically in the top of the teeth. And having something sweet or sugary can sometimes sit into those grooves and cause a sensation or a pain. Now, how old is your daughter, if you don't mind me asking?
She's 16, but she's been doing this for about 2 years now. And she does dentist anyway.
So if you're seeing the pattern, my recommendation is that you ask your dentist if they would consider doing fissure sealants. And essentially what they do is they seal up those fissures and it can sensation and some of that pain. But yes, sugary or hard foods and drinks can cause that sensation. Also, there is such thing as referred pain in the mouth. So it can be one area that actually causes the pain and you feel it in a completely different area. Okay, so that can make things a little bit complicated. Does she have fluoride varnish when she goes?
She's had the fluoride varnish, but she was under general when she had that, and I just wondered how easy that is to apply when they're not under.
Yeah, so it's a matter of getting it onto a little brush and painting it on. So it's not keeping the mouth open for a long time. It doesn't have to stay dry or anything like that. So that again would probably be really helpful. Some people that have oversensitivity and things like that. You could also look at sensitive toothpaste. At 16 she could use one, and sensitive toothpaste can be used like a cream, so you can use them like a topical, so you can literally rub them in to areas of the mouth like a cream.
Thank you. No, it's really useful.
You're welcome.
Just, Ruth, was that your hand up again, or is it a legacy? Yeah, okay. You're sorry.
So basically we use Aura Nurse, we use the dentist in Kidlington that the other lady referred to, but we can't get Jake in there. She used to come out and see him in the car, but the last time we saw her, she told us that wouldn't be able to continue now that he was 18. I've got to admit he hasn't been for some time because he was worried about that. Is there any way we can get a home visit? We do that with eye tests because he won't go into the optician. The optician comes to us instead.
Yeah, so domiciliary visits again go through the Thames Valley Oxford Community Dental Service. So when you get the slide and you get that link, it's your contact. I have got the contact address, email address for the lady that does sort of similar job to me, but for them. So if you struggle, if you just pop me an email, I can liaise you directly that way, just to find out a little bit more information about domiciliary visits. But they do offer them. There
is a duty, though, isn't there, for around reasonable adjustments in anything to do with health? Does that include dentistry?
Yeah,
does that
include? Yeah,
it should do, shouldn't it?
Yeah.
So you could still bring out the old, actually you've got a duty to make reasonable adjuststments, Ruth. I would be, because that whole, they're now 18.
Yeah. No, I think things have probably changed since she said that to me, and I just have gone back.
I just think you don't ask, you don't get, do you? That's it. And then just throw in the, oh, well, isn't there a duty under the NHS or under the dental? Yeah, health anyway. So is Jackie, did you want to come in again, or is that an old one? I think that's an old one. Okay. Yeah.
You asked as well about the sedation thing. I am really interested in that. I didn't know that could happen. It
was an extreme. That literally was. He was stopping eating, which Guy eats constant. I mean, he just loves his food. So that was a big alarm bell to us, and we just kept looking to see this was quite a few years ago. So in order to go and have a really good look in, they did a kind of, they didn't knock him out completely. They just did this kind of, I don't know what they did. They wafted something over him, and it a bit like, I don't know, you might know, Sophie, what it is.
Yeah, so they do a gas and air type thing. The only thing to be really conscious of, we were actually talking about this yesterday, is it doesn't smell pleasant at all.
No.
So if there is a sensory to smells, that might also be quite tricky. There are certain practices, so again, it's not generic, so you're not going to walk into every dental practice and then be able to offer any sedation or pre-meds, because some of them can offer you a pre-sedative to calm you before you then go in, and so can a GP as well. So that could be another option, Ruth, is that you chat to his GP and see if maybe they could offer a pre-sedative before you go.
I think we were referred to somewhere in Banbury. Now he lives in Didcot, but we referred to a dental surgery in Banbury that did that specifically. And he now goes there about once a year. They've agreed it's in his best interest, because again, you've got to go through the mental capacity stuff to have that, so they can get a really good look, because his teeth, he'd lost 2 teeth. They got so bad, and that's why he'd stopped eating, but the dentist couldn't get in and have a look, and the staff couldn't get in and have a look. It's really difficult.
I'd really like to do that as a preventative, rather than get to the stage where something
happens. That's what we're doing now. Yeah,
absolutely. Another option, Ruth, is not ideal at all, but there are private practices that do offer it as well.
They do. Thanks, Sophie.
Welcome.
Okay, well, if anyone else has got anything else for Sophie. No,
I'll pop my email into the chat box, so it's available for everybody if you want to use it. Anything, we're always here for any questions.
Thank you so much.
I was going to say, I'll do a follow-up with all the information that you've and a link to the actual recording once we've got it up, so that people can keep referring back to it if that's what they'd like to do.
Brilliant. Thank you so much, Sophie. That was really informative and really helpful. I hope other parents found that useful. So thank you.
Lovely. Thank you all so much. Appreciate it.
We'll be in touch with recording links and everything. So
perfect.
And thanks, Kathy.
Thank you.
Thank you.
You might stop the recording now, Sophie.
Yes, I will do. Yeah.
Brilliant.